This is the EMS Research Vlog and Podcast, where we talk about the research-related issues that matter to those who work or study in the area of emergency medical services. Your host is Bram Duffy, who is a paramedic and communications professor.
Welcome to the EMS Research Vlog and Podcast from the studio here in Houston, Texas. I want to start out by drawing your attention to our website where you can check out anything that's show related when you go to professorbram.com. That's professorbram.com. At the website, you can find the latest show, see my talks in the media, order the latest book, and also look at how to participate in research. This is all stuff that can help you grow in the world of EMS research. Like right now, I have a research study open for first responders. So if you don't mind being interviewed by me, then go to my website at professorbram.com and click on the current research tab to apply. I'd like to welcome Dr. Hoi See Tsao, who is an assistant professor in the Department of Pediatrics at UT Southwestern Medical Center and practices at Children's Medical Center, Dallas Children's Health. She specializes in pediatric emergency medicine, and it's not just that, it's also that she focuses on emergency medicine with pre-hospital focus and EMS and medical education and even simulation stuff. So Dr. Tsao earned her medical degree at Harvard Medical School and completed her residency in pediatrics at Mass General Hospital for Children and received advanced training in pediatric emergency medicine through a fellowship at Hasbro Children's Hospital and the Warren Alfred Medical School of Brown University. She also holds a Master's of Public Health degree from Brown, and I'm so happy to have her on the show to talk about her article. So welcome, Dr. Tsao.
Thank you so much for this incredible opportunity. I'm so excited to be able to share some of my work with everyone.
Well, I was really impressed because when I go through and spend time to find articles that I think that folks who work in emergency medicine would really care about, this came to the top of my list. And so thanks for responding. The article, Barriers and Enablers in Prehospital Pediatric Anesthesia, this was put out in Prehospital Emergency Care. And I want to just summarize it for us all, and then we can talk about it together, because this study looked at what makes it harder or easier for EMS workers to treat children's pain during ambulance rides, especially after introducing a new type of pain relief that's been publicized a lot, which is fentanyl that we can administer through the nose. It's just like a squirt. And EMS workers do face challenges like worrying about whether the medication that they're giving is a safe one for the kid. And there's stress and a lot that goes into putting IV lines in. And of course, the environment's totally foreign, and parents are unsure or uncomfortable maybe with opioid uses. And so other issues like EMS workers that maybe don't have enough experience with children, that can even do it to make them hesitate to give pain medicine. And what happens is that they worry about it maybe hiding the symptoms before the child reaches the hospital. So there are lots of different situations that mean that the paramedic might not feel comfortable giving pain medicine. And on the positive side, certain situations made pain treatment easier, like when children showed clear signs of serious pain, when there was enough time during longer ambulance rides, and when EMS workers felt confident using this intranasal pain relief. The focus groups showed that some ways to potentially fix these problems with look at requiring EMS workers to have better training and including maybe a more realistic practice way of training, and also thoughts about building better communication with medical experts that provide guidance. Part of this, of course, is teaching parents about the safety and benefits of pain relief, and helping reduce their hesitation to being able to provide the pain relief that might really be needed. And so the study found that this intranasal fentanyl made it easier for EMS workers to manage kids' pain, but that there's still work to do. So, more training, hands-on practice, and improved protocols are needed to really help make sure children get better pain care during ambulance rides. And so I know that this study involves the work that you did with focus groups and also looking at this intranasal fentanyl. So can you just, Dr. Tsao, tell us more about your research study, and maybe start out with helping us understand more about what intranasal fentanyl is.
Yeah, thank you for that wonderful summary of my studies. So the intranasal fentanyl is a medication that is administered through the nose. And so what you essentially do is you usually have a syringe with that medication, and you attach it to an atomizer that then lets it essentially be squirted or distributed into the nose. It basically is given this in a similar fashion as other intranasal medications like intranasal naloxone. So it does offer another great alternative in terms of pain medication, because often some of the pain modalities that we think of or are oral, such as acetaminophen or ibuprofen. And then the other way to administer medications are usually through an IV, but that also brings its own challenges, especially in terms of trying to get IV access in a moving ambulance on a bumpy road, or in kids who have really small veins. And so this is a really exciting new pain modality, pain medication modality that we can use to help to alleviate pain in kids that does not require IV access.
Okay, so we have this new intranasal fentanyl out. Tell me more about your research study.
Yeah, so I first became interested in this study because we know that pain in kids is something that is, of course, like good to be treated. But to spell out a little bit more, usually when pain is not treated in kids, there have been a lot of research studies that have shown that it can lead to a lot of adverse effects down the road for kids, such as having them becoming more scared of future healthcare encounters down the road, having decreased pain tolerance, having increased anxiety, and all these things, of course, for kids can be very detrimental. And so there's actually been a lot of research and push from a lot of national organizations to really try to help control pain in kids from the pre-hospital setting, meaning like in the ambulances, all the way to the emergency department and during their hospitalization stay, all the way until they go home. So that's how I first became interested in this study. So we essentially gathered two focus groups or groups of EMS providers because I was interested in their on-the-ground experience managing pain in kids. So we asked these EMS providers, what has your experience been like assessing pain and also giving pain medications? And what has the reaction been that you've gotten from families when you've given that pain medication? And we found that there are three big themes that came out from speaking with our EMS providers. The first is that, and usually pediatric transports are usually rare for a lot of EMS transports. And so there isn't a lot of experience, real life experience working with pediatric patients. And so that can sometimes lead to some discomfort in terms of what to give pediatric patients and how to best work with them, especially in managing their pain. We also learned that a lot of times they do rely on, or they can sometimes talk to their medical control specialists. So speaking to someone to guide them in terms of how to manage pain. And depending on who they talk to, it can be either helpful or sometimes less helpful. So that can be a mixed bag depending on who they get on the line. And finally, BMS providers felt that training is very, very important, but there's really no substitute for just having real life experience in terms of transporting kids and managing pain on their own.
One of the things that seems to come from this is the uncomfortability with folks who don't have kids on their own and aren't used to being around kids. Was that something that came up?
That's a really good question. It wasn't something that we specifically studied,
Yeah.
but I do think that now that I'm a parent myself as well, that it definitely has helped inform my work as well,
Yeah.
for sure.
Well, what were there any surprises that came up with folks that were sharing with you about their experience, you know, d- trying to help a child in pain?
Yeah, so one of the surprises that came up for me was that some of the families uh, were not very sure about what medications or what pain relief EMS providers could give. So that was an eye opener for me. And so it also speaks to, I think, that we need to do a little bit more education when working with families to help them understand that, when an EMS provider comes and works with their kid, they have a lot of different pain medication strategies that they can use to help start treating that pain from the start. Even things like acetaminophen or ibuprofen, or in the setting of a fracture, putting on a splint, using ice. These are modalities that they can use to help treating that pain. It doesn't necessarily have to be let's go to the hospital and then start pain management at that point.
Yeah. And so how about the fact that, well, I'm thinking through all these situations that I've been in myself, and I'm thinking about how the confidence of that paramedic might also lie into a lot of this stuff. And just the fact that we're talking about fentanyl, and there's so much negativity that
Mhm.
has, surrounded that particular drug. How do you feel about that kind of influence?
Yeah, that's a good question. So I think that there can sometimes be a lot of negativity surrounding fentanyl. I think that part of uh, uh, I guess working with that is trying to figure out where that negativity is coming from on the part
Yeah.
of families, and trying to understand what their fears are exactly. I think that in the press, especially, fentanyl sometimes has gotten a lot of bad attention because of how it's used in terms of street medication or street drug. But really, when we are talking about fentanyl, especially in the medical setting, it's very controlled. It's the doses that are used are very safe, and have been studied in kids in terms of the adverse effects, to make sure that it's administered in a very safe manner and that the dosage is correct as well. And
Hmm.
sometimes that may not be the case with fentanyl that's obtained elsewhere.
Oh, for sure. Yeah. And on a lot of ambulances, we might have, a couple, three different options. But really the choice that is because of the circumstance. And so, in one case, we might worry about sedation too much, or in another case, we worry about the effects of the medicine lasting too long. So
Mhm.
there are different the reasons, and of course, the fact that this can be given, easily through the just the squirt up the nostril. I I think that there's so many different things to uncover, in this particular topic, because we're in a stressful moment with a child that everyone wants the pain to stop.
Mhm.
And there are interactions that are happening right there between the paramedic and the family, and trying to make things better. And I think that any kind of uncertainty during that moment doesn't come across good. And I think about, how we um, could really do better to practice these scenarios,
Yeah.
and I think that was one of the things that came up in your article also, is to be thinking about more realistic ways to help people be ready for these situations.
Hmm. Yeah, I think that there can definitely be a lot of discomfort, and kids, depending on their age group and their personality, I suppose, they can be very scared of healthcare workers and strangers, especially if they have masks on. So I think that a lot of working with kids, as well as and just in general, working with kids involves trying to do the best that you can. So also using language to make it a little bit more maybe acceptable for kids. So maybe
Hmm.
that we can't completely take away the discomfort. But for example, saying things like, when you're putting the pulse oximetry on, saying, okay, we're going to put a little sticker on your hand and it's going to make
Right.
your finger turn red, things like that, just to make it a little bit more acceptable, like for the child, depending on the age. Or letting them know, okay, we're going to give you a little medicine up the nose, and if they're old enough to understand, just letting them know it's going to burn for a little while and then it's going to go away. So I think that those are also strategies that you can use to help make it a little bit more comforting, at least for kids and hopefully their families as well.
Yeah, for sure. And one of the things that I try to get across to my patients, tell me what you think about this. For these cases of severe pain, this pain medicine does not make the pain stop. It just makes the brain not care about the pain so much. So what that means is that there are cases where you can't give enough pain medicine because it's not safe at some point, right?
Right,
And so it's like that sometimes has to get communicated because
right,
we're we know it hurts,
right.
and sometimes there's just not a way to stop it no matter what we're doing.
Right, 100%. And I think that you hit the nail on the head. I think it's also about setting expectations as well, that we're giving the pain medicine to take the edge off. It's not going to take that
Hmm.
necessarily 100% away, but we want them to be in a more comfortable spot so that we can at least transport them safely to the hospital.
Yeah, I like how you say that, take the edge off, because it sets up that expectation. So what were some of the main things that made it more likely for these EMS workers to give pain medicine?
So some of the things that we found that made it more likely for EMS workers to give pain medication included if the transports took longer, they were more likely to give pain medication. Also, if there were specific injuries or vital sign and changes that were more suggestive of high pain levels, and that
Yeah.
also made it more likely. The other thing that we were very excited to find was also if the EMS worker was comfortable with using intranasal medications, it also made them more likely to give pain medicine as well.
Mhm. Yeah. And so if you've done something before, for sure, that makes it more comfortable and you have practiced that before. So were there any moments or stories that got shared in these focus groups that really stood out as eye-opening to illuminate this dynamic about what's happening in these moments for um, providing management of pain?
Yeah, so yeah, I can think of probably two stories. So one was one of the EMS workers shared a story about a child who had a clearly broken arm, and the parent on scene was very, worried and scared, understandably, and so was just screaming at the EMS worker, let's just get to the ambulance, let's just get to the ambulance. And that EMS worker had to really work with that family to explain, I am going to put an IV in so that we can get this pain better managed, so that we can really help to, take better care of your kid this way. And so there was a lot of education that happened in that moment. But eventually the family, it sounds like, came around and were willing to let the EMS worker do that for their kid. So I was really excited to hear that, to at least get that pain management started. So that was one of the stories.
Yeah, and it just reinforces in my mind about how much this communication thing, it ties into helping with pain management, not, well, of course, with the family and with the little one.
And then the other story I recall was with just the asking for resources. So I remember one EMS provider was speaking about how they hadn't worked with a lot of kids before, and how helpful it was to talk to their medical control person and try to get recommendations in terms of what medications to give, and how much better they felt when they saw the child be able to calm down by the end of their transport. And so that was
Mm-hmm.
really gratifying to hear as well.
Mm-hmm. Well, right on. What about other pain management options for kids?
Yeah, so we talked about it a little bit already, but there's for in terms of oral medications, so there's acetaminophen, ibuprofen, and we know that those are very safe medications. they're over the counter as well for kids. So also a testament to how safe they are as well. For fractures, part of pain management involves immobilizing and keeping that fracture still. And so splinting is a huge thing that EMS providers are amazing at in terms of pain management. Ice can also be used in those situations as well. For burns, for example, there's some EMS workers can have certain burn dressings that they may have in their trucks that they can use as well. And then depending on your EMS ambulance company in which state you work in and the state protocols that you have, some places may also have ketamine as well on their pain management protocols, as well as nitrous. So it depends a little bit on your state protocols. And then the other one that I forgot to mention as well is morphine as well.
Mhm. So I think a lot of us are familiar with ketamine and morphine.
Mhm.
Do you have more to share about nitrous? Because I have always heard about that as an option, and I personally think about the dentist's office when I think about nitrous. So, um, uh, yeah, could you comment on that or tell me more about that aspect of pain relief?
Yeah, that's a good question. So this study was performed in Rhode Island, and in specifically for nitrous, I would say that not a lot of providers have the equipment set up to have it run, and in my experience, very few, if any, providers came in
Hmm.
having given nitrous. So I would say that it's definitely something that is not given very commonly at all.
Yeah, I didn't think so either, but I sort of know that some places somebody, so, and I'm just gonna guess maybe it's cost or maybe it's maybe
Yeah.
these other things work better. I don't know. But what advice do you have for EMS workers or healthcare providers who, might struggle with confidence when they have to treat little ones, when they have to, work with kids who have pain?
Yeah, that's a great question. So I think working to build that confidence and comfort. So as much training as you can get. There's lectures, there's PALs, there's EMS expos, things like that have training opportunities. But I think the better training opportunities are ideally the ones that you can get that mimic real life as much as possible. So ideally, really high fidelity simulations. Um, and also, if your agency has some type of case, I guess, debriefing or QA initiatives, I think it's also helpful to review cases of what other EMS providers have taken care of and how they manage that particular situation would be really helpful. I also want to share a resource as well that is available on the EMS for Children website. There are these PEAK toolkits, which stands for Pediatric Education Advocacy Kits. And so they span a whole range of different topics, and one of them in particular is on pain. And so it specifically goes through how to administer intranasal medications, some of the common pain medications that you can give by EMS workers, how to work with the kids who are in pain, and how to make it more acceptable for them to hopefully be at least amenable to receiving pain medications as well.
Okay, so that's on a website we can put up.
Yeah, absolutely.
Awesome. All right, well, we'll do that. And I want to thank you for being on our show. This is all great stuff. So before we go, is there anything else that you want to throw out there for our viewers?
Yeah, I just want to, thank all our amazing EMS workers out there. You guys are on the ground taking care of these kids, and thank you so much for, doing all that you guys do and helping to make sure that they come to the hospital safe and sound. So thank you.
All right, Dr. Tao, thanks for being here. And I'll put your link up in the description below.
Thank
Thank
you. I
you.
appreciate your time.
Like many of you, I'm also an EMS instructor, so I know what it's like to have topics that are important to cover but are not actually in your curriculum. So when it comes to EMS research, I want you to know that I've been joining EMS classes lately in a virtual kind of way.
It's fun for me to meet your students and talk about EMS research, or even talk about how things are done differently where I am versus where you are. So if you're an EMS instructor like me and you want to give your students a flair of what EMS research is all about, just fill out the inquiry form on my website at professorbram.com. This is professorbram.com, and I'll be in touch. I want to also invite you to check out my latest book. I co-authored it with 4 Arrows, who has 2 doctorates and is an expert on indigenous scholarship and hypnosis.
We've got to look at each individual patient as a human being who is in need. And we've got to know that when we're in need, we do look to others, no matter how self-reliant we are. If we are in a situation that we've never encountered before, that self-reliance begins to seek, is there anyone that can help me with this situation? I mean, you've used a pretty drastic example with the arm cut off, but I don't care how much skill you have. There's very few people who would be able to not say, "Oh my gosh, I need help," and then all of a sudden someone shows up
with a badge.
Yeah, and you think, well, maybe this is someone that can help. Well, you said that, and I said that, during the first hour of trauma, people are essentially in a state of what we now know is hypnosis state.
I want to invite you to check it out because we introduce a method for communicating with patients on the scene of the emergency that takes advantage of some of the properties found in hypnosis. The book works to change the way we approach and interact with any emergency patient who's in acute distress, and it can help you be a better practitioner. The book is called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. Follow a link there below to find it, or you could get it almost anywhere books are sold. And if you contact me, I would be happy to mail you an autograph sticker designed to be put into the jacket cover.
Hi, I'm Will Chabot from the International Prehospital Medicine Institute. You might know about us because of the literature reviews that we post every month free for your review on our website at iphmi.com, and also published through GEMS Online magazine every month. We've been doing them for 5 years, so now we've accumulated over 240 literature reviews over the past 5 years. And we've gotten feedback from our audience that said they'd like to have these things as desk references, so they'd had a rapid reference. Well, we've done it. And there are now 5 volumes of these books, one for each year that we've been publishing them. This is the latest version, volume 5. And as I said, in each of these, there's at least 48 literature reviews. They're all cataloged in the beginning of the book, so you can see what the topic area is, what pages those reviews are on, and how you can find them quickly. And again, these are a great reference, whether you're putting a lecture together, working on a paper, studying, whatever it is. This gives you the depth of field of the science that dictates what we do in the field, or what we should be doing in the field, or why we've changed the way we do things in the field. In any event, as with all of our publications, we've priced these because we want you to be able to have this book. It's only $4.99 in the hard copy here, and they're all 5 of them are available at that price. But you can also get them as ebooks, and they're available as ebooks from Amazon, from Apple, from Barnes & Noble, wherever you get your ebooks for the price of $2.99. So again, we don't do this with an aim towards getting wealthy. We do these because we want you guys to be able to have these materials, relevant information, affordable information, and an access so you can get to it. So you want the hard copies, go on Amazon, $4.99. Go to your ebook store and you get it for $2.99. If you're in the business, this is the kind of material you want to have around to settle those firehouse arguments or to help you put your materials together. Thanks again. See you all soon.
I'm doing a research project related to first responders who live in the United States, and I could use your help if you don't mind being interviewed over a video call. Go to my website and fill out the form. It's at professorbram.com, professorbram.com. I just want to thank you for listening, and I look forward to sharing more insights with you in the next episode. If you enjoy EMS research, please tell your friends and like, share, and subscribe to help others get the message.